There it does. Starting recording.
Perfect. Okay. Alrighty. Sorry about that, folks.
Okay.
This is part 2 of my conversation with with Margaret Kimberley. So yes. So Margaret. So I want to ask you about the ongoing coronavirus crisis. And so again, so putting aside, the origins of the virus and the minimalist arguments and the denialist arguments, and just accepting that COVID is a real medical issue, came from, bats put in terrible conditions, and we need to respond and overcome this pandemic. What do you think should be the left's response? What is your left-wing circle advocating? And if the vaccine produced by big pharma isn't safe and we need more time to develop a supposedly safer one, then don't we need to go back into a 6-month lockdown until a safe vaccine is made? And then, if that is the option, then don't we need to be advocating, like you said, shouldn't we, the left, be advocating that rents, mortgages, and taxes are suspended, universal basic income is given, businesses that are under lockdowns get compensated and bailed out, they're not allowed to go bankrupt. So that's basically my question, and your thoughts on the COVID minimalists and denialists who are even overlooking the fact that so much of the anti-lockdown, anti-mask, and anti-whatever protests are far-right reactionary folk.
Well, it's complicated. In this country, this country has failed utterly. The first year of the pandemic, Trump was still president and everything was blamed on him. And I'm not going to say he didn't deserve the blame. But there have been more deaths in the past year under Biden. We just hit 900,000. It's going to be almost 1 million people who died from COVID. And first, excuse me, so we need a better healthcare system. This corporate-run healthcare system does not serve our needs. So, for example, when there is a surge, and COVID, it's like all viruses, it changes as time goes on. So the last surge was Omicron, the Omicron variant in December, and throughout much of January, there are these huge numbers of people in hospitals, even when it's allegedly mild like Omicron, although people still died. I think it's still a couple thousand people in the United States dying every day.
And there are still people arguing that, and this is the COVID minimalist, there are still those who argue that this is just like the flu. Where are you guys getting so fed up?
Yeah, it's like, and this nonsense, it's like, well, they die of COVID or with COVID. I think it's a distinction without a difference, and it allows people to engage in wishful thinking. But there has been a problem with the vaccines. They don't work the way people think of vaccines as working. So, for example, the term is sterilizing immunity. So the measles vaccine, if you get a measles vaccine, you're not getting the measles, period, the end. But that's not how these work. They may, in fact, keep some people from being infected. They definitely cut down on the number of people who become seriously ill or die. You see these very lopsided numbers between vaccinated and unvaccinated and health outcomes. But rather than be honest, so they were sold as, this is it, this is the panacea. We're going to get everybody gets the jab and it'll all be over. Nobody will catch it. It won't spread anymore. But that's not what happened, because it keeps spreading. You always get a new variant. It goes up, it goes down, and everyone says, hooray, it's, we're back to normal. No, it's not. We're not back to normal, because no sooner had Delta disappeared than we got Omicron. Yeah. So the nature of the virus itself, the nature of the vaccines make it difficult. But instead of the Biden administration being honest with people and saying, the vaccines didn't work quite the way we hoped, and you can still catch or spread COVID, they doubled down with mandates, which only increased resentment. So people were very resentful. So here in New York City, the former mayor. So here in New York, you can't go to a restaurant unless you're vaccinated. You can't go to the movies. You can't go to a theater. Can't go to a museum. Most public places are off limits to people who aren't vaccinated. And I think it's fine for people to say, well, if you could, if they did have sterilizing immunity, you might be able to make an argument, but they're not. So that's not true. So what is the purpose? And I think it makes everything easier for them. The government doesn't have to spend money, doesn't have to help anybody. They, can give all this money to big pharma, which is what they want to do anyway. So the demand for vaccines leveled off. Then it was, well, get a booster, you'll be safer. But the numbers of people getting boosters are low because you don't have that trust anymore. So, as far as these Canadian truckers who, among others, their government said they couldn't cross the border into the U.S. unless they were vaccinated. But I, had a good point. If I'm not really immune, if I can still catch or get COVID, why is there a mandate? And I think that's a perfectly reasonable question. But they just keep doubling down on things instead of saying, that's not how it works. We're going to have a mask mandate. And so let them drive through Buffalo or, whatever city on the border between Canada and the U.S. That's fine. But I believe Canada also had restrictions just in general, not just for crossing the border. So people react to something that's just not fair, not merited by the science. And so I didn't, having said all of that, I didn't feel this kinship with the truckers that a lot of other people did. So people said, well, if you're on the left, you've got to support these workers. And other people say, no, they're owner operators, they're petty bourgeois businessmen, you don't have to. Then there were people like, well, all their money's coming from the right wing. And then the Canadian government, then they, pass this emergency act and say they're taking people's money and all of these things, which there's no good reason to do. But all of these missteps and well, not just missteps, but wrong decisions by government just increase resentment and increase the lack of trust. So when you tell people it's a good thing to get a booster, then people say, why? Why should I bother? I got the vaccine. And then, of course, when people get vaccinated but catch COVID anyway, well, then they're very angry and they're like, well, I don't believe any of it anymore. But I think the science does show that COVID is very dangerous to some people. And this is the problem with it. So there are people who do have a mild case. I have a friend, for example, who I think he said he had a headache. He only got tested because his roommate got sick. And he found out he tested positive. But he said he really didn't have any symptoms. But there's still people who end up in the hospital. And there are people who end up with, they're calling it long COVID, people who never recover, who have symptoms now going on for almost 2 years.
Wow.
There's indication of heart damage, of organ damage for some people. And that, I think, is part of the problem. So one person can say, well, I had it, I was sick for a few days, but now I'm fine. And there's somebody else who still can't breathe after 2 years. So there are people becoming disabled because of COVID. So I think it's very dangerous to just dismiss it. We know that masking works. We know that air purifiers work. This is something that has not been talked about. COVID is airborne, meaning what we were told about droplets and, stay 6 feet away from people. That it doesn't work that way. It's like the analogy I saw that made sense to me was more like smoke. So it's like, if there's smoke in this room, it doesn't help that you're more than 6 feet away from somebody else, but an air purifying system would help in indoor spaces. So things that are overlooked that could work, that could help people, and when it's not done, it just increases cynicism. So people don't want to get a booster. The people who didn't want to get vaccinated, anybody who hasn't been vaccinated yet isn't going to get vaccinated. They don't want to. I know people who've been forced into it because their job says you have to, or they want to travel somewhere where it's required, and so they do it. But the failure, the public health failure, has breeded a lot of cynicism. And these people who say it's not real, or, they want to believe, somebody goes online and says ivermectin works, and there's still no proof that it does. I don't care if a doctor wants to prescribe it, let them prescribe it. But people shouldn't think that it works when it doesn't. So, the lockdowns are problematic. So I think they have to think about ways to keep people safe without the lockdown. But now everyone's saying, well, it's over. We're getting rid of all the restrictions. Mask mandates are ending. They're trying to force businesses to have everybody work back at the office. A lot of people like working at home. So I don't think this let it rip approach is going to work. There is some natural immunity, but like the vaccines, it wanes. So the people saying, well, I already had it, so I'm safe. Actually, no, you're safe for a period of time. No one is sure how much. It depends on the variant. Delta provided some sort of immunity. Omicron does not. There are already people who've been reinfected with Omicron, so that's not true. But I think the lack of honesty and the fact that it's been terribly mismanaged mean that it's very difficult to come up with public policy to address the issue of COVID.
But at the very least, those of us on the left should, who aren't minimalists and aren't denialists, should at least be advocating that we need UBI. Businesses, however big or small, need to be bailed out. Suspension of rents and mortgages, especially if you're unemployed for however long precarious.
Just help the people.
Time.
Help the people. Public healthcare system, but we have this privatized healthcare system. So up until now, insurance companies weren't allowed to charge for a lot of things, but that's ending. So. For these at-home tests or treatments, it's like the horrible health insurance companies or the Biden administration. They were criticized they were told in October. Scientists told them send out 700 million test kits before the holiday season, and they didn't do it. And that's the moment when Omicron surged, and it could have helped a lot. So. It has not been addressed the way it should have been. And the consequence is it continues to spread. There's already, I'm calling it son of Omicron. There's always, BA2. There's already a subvariant of it. And so I don't have a lot of confidence that this is going to be resolved anytime soon.
All righty. And remember, folks, you may not believe in Rona, but Rona does believe in you.
Yes. Thank you.
All righty. Well, unfortunately, we have to close this. We were joined on this special Black History Month special episode of 1+1 with the brilliant and fine indie journalist, media critic, NGO critic, peace, social, racial justice activist, and historian Margaret Kimberley, the senior columnist and executive editor of Black Agenda Reports and a member of Black Alliance for Peace. I'm going to make sure to post links where people can find those websites to donate generously and subscribe to, so that they know future events that Black Alliance for Peace will be doing. And also, never miss an issue. Plus, I'm also going to link to Margaret's Patreon, which people should check out, because it's money better spent than HBO, Amazon, or
Absolutely.
Disney Plus. So, my dear comrade Margaret, thank you so much for joining me today, especially on Black History Month. I look forward, hopefully, to having you back in the future to discuss imperialism, and also something which isn't talked about much in the Black community, but the need for solidarity and coalition building between our people and Indigenous Americans, Hawaiians, and Alaskans in order for us to smash white supremacy and ongoing settler colonialism. So I look forward to having you back on in the future. You have a fantastic weekend, and thank you so much for joining me today.
Thank you so much, Youri. Thanks.